Hi, Jasmine.
Hi.
Everyone deserves to feel empowered to take control of their health and well-being in the aftermath of violence. The District of Columbia Forensic Nurse Examiners, also known as DCF&E, is a nonprofit organization serving adults and adolescents. We work to reduce the impact of violence in our Washington, D.C. community by providing medical forensic exams to people 13 years and older who've experienced sexual assault or domestic violence. What exactly is a forensic nurse? Forensic nurses are registered nurses or advanced practitioners who provide specialized care to people who've experienced violence. Unlike other healthcare professionals, forensic nurses are experts in consent-focused medical care, injury documentation, including photography, and evidence collection, including how to collect a sexual assault kit. Importantly, forensic nurses bridge the gap between the healthcare and legal system so that if a survivor pursues legal action, their exam report and any evidence collected are available to law enforcement for court proceedings. DCF&E supports patients with professionalism and understanding. Our goal is to meet patients where they are physically, emotionally, and psychologically, ensuring survivors understand their options and choose the care that will best enable them to pursue healing and justice.
A medical forensic exam is tailored to the needs of each patient. Our forensic nurses prioritize consent, providing a comprehensive approach to care that centers comfort, safety, and respect at every step.
All right, so a couple things I wanted to remind you about before we get started. Number one is consent. So anything that we do today, you have complete control over, okay? So you can revoke that at any time. If at any point you want me to stop, just let me know and I will stop, okay? Secondly, everything that we talk about and do in this exam room is confidential between you and me unless I'm required by law to report it, okay? So we talked earlier about our evidence collection kit and photography. Is there anything else off the top of your head that you wanted me to address at this time?
No, I don't think so.
All right, so are we ready to get started?
Yeah, please.
Okay.
During an exam, the patient will be given options for care based on the assault they experienced. The exam will vary based on the patient's preferences. It can include as little or as much as the patient wishes. A patient may encounter any of the following steps during their exam: a detailed medical history and history of the assault, with attention to the physical trauma experienced, a head-to-toe physical assessment, with photography to document injuries or other findings, treatment of medical concerns including medications to prevent infection, HIV, unwanted pregnancy, and other potential concerns, emotional support from patient advocates, and connection to community resources. The exam can also include more specialized steps such as evidence collection, which may include body swabs, clothing, and other samples preserved in a sexual assault kit. Toxicology specimen collection when drug-facilitated sexual assault is suspected. Use of specialized tools such as light sources and dye that helps the nurse to assess areas of the body where evidence or injury may be present.
So as we move our way down to the pelvic exam, I wanted to talk a little bit about the speculum exam. I'm going to talk you through every step of the way at this point, okay? Any part that I'm not examining at this point, we're going to keep covered. So in order for you to be in control, I'm going to have you help me hold the drape here, and if at any point you want to stop, you can just drop it for me, okay?
Throughout the exam process, patient autonomy is our number one priority. Forensic nurses prioritize the patient's consent, ensuring that each step of the process is explained, offered as a choice, and the patient feels empowered to decline or change their mind at any point.
I have some discharge paperwork for you here, okay? So let's go through this together. So this page here, this pink sheet, is a good list of phone numbers and resources for you to contact. So we will be contacting you tomorrow by phone sometime between 9 a.m. and noon, just to follow up with you, see how you're doing since the exam today, check in on you, see how you're doing with the medications. Is that okay?
Yeah, that sounds
all right.
Exams are available to all survivors regardless of sexual orientation, gender, gender identity or expression, income status, race, ethnicity, religion, immigrant status, or ability. Importantly, DCF&E services are provided at no cost to the patient.
We have a selection of quilts, and you are welcome to take one home if you would like.
I would love.
Okay, wonderful.
Exams are available 24/7 at the MedStar Washington Hospital Center Emergency Department. Walk-ins are welcome, and free transportation assistance is available by calling the DC Victim Hotline. Here are some commonly asked questions about the exam process. If I have an exam, do I have to report to law enforcement? No, it's your choice whether you decide to make a report. If you aren't sure about reporting, you can have a sexual assault kit collected and preserved by DCF&E for up to 2 years while you're considering your options. If I don't plan to make a report, are there other benefits to getting a medical forensic exam? Forensic nurses have specialized training to care for your health after an assault, meaning that your nurse will be able to assess for both visible and hidden injuries, identify potential complications, and recommend follow-up care. Survivors can choose to have a sexual assault kit collected without reporting to law enforcement, which is an opportunity to preserve potential evidence related to what happened in the event that you might decide to report in the future. How long does an exam take? The length of time varies based on the type of assault and the patient's preferences for care. Exams for incidents of sexual assault usually take 4 hours on average, while domestic violence exams typically take 1 to 3 hours. Can I bring someone to support me during the process? We want our patients to feel supported, which is why we partner with sexual assault advocates who are available to provide support at the time of exam and afterwards. If you do bring a support person, there may be portions of the exam where we request to have only the advocate present. This allows us to perform a thorough exam and ensures that evidence is collected and preserved properly. At DCF&E, we are here for you 24/7. You are never alone. Together, we can help you take control of your health and well-being.